Cochlear device implantation, with or without mastoidectomy. The physician makes a U-shaped incision, creating a skin flap well behind the mastoid, and drills a circular depression in the squamous portion of the temporal bone in which the internal coil will be housed. The mastoid air cells are removed with a drill, and a facial recess approach is used. The bony ear canal is preserved. The internal coil is secured in the depressed area of the temporal bone, and the electrode is introduced through the facial recess in the round window into the cochlea. The ground wire attached to the internal coil is introduced into the temporalis muscle. The incision is sutured. Implantation or replacement of electromagnetic bone conduction hearing device in temporal bone. Through a post-auricular incision, the physician drills a circular depression in the outer skull cortex behind the mastoid cavity. The internal coil is seated in the circular depression and secured to the skull with titanium screws. The subcutaneous tissue over the internal coil may be thinned. The wound is irrigated and repaired with sutures. A dressing is applied. Osseo-Integrated Implant. When conventional hearing aids or surgery are not effective, osseo-integrated implants have been of great help in auditory recovery in certain types of people. The most recent innovation in this type of hearing aid is that osseo-integrated implants are totally hidden under the skin and only require adaptation by magnetic induction of a small external element when the patient wants to use them. Implantation, osseo-integrated implant, temporal bone, with percutaneous attachment to external speech processor/cochlear stimulator, without mastoidectomy. With mastoidectomy, the physician makes a small break in the skin at the temporal bone and angles and places the stem of a titanium pedestal toward the cochlea, leaving a bridge of bone between it and the cortical mastoid. A tunnel is drilled to create a passage for the electrode array and the stem of the titanium pedestal is tapped into a tapered hole in the mastoid.